So, I want to start by looking at this topic of what we put in our mouths, eating, and why we eat and how we should eat. It's a big topic, and it's responsible for a significant percentage of the effect size that's compromising people's health today because we make poor eating choices. So the first question we want to ask is, why do we eat at all? I mean, when you think about all the time and trouble that's associated with eating, the shopping, the chopping, the chewing, the defecating, why don't we just stop it altogether and just say enough is enough and not do any more of it? The reason is there's a need to eat, and we have to ask ourselves, what is it about eating that we need to do? If we don't eat, well, we die. But the question is, why do we die? Do we die from what? Boredom? Or is there something about eating that gives us something that we need to survive? And the answer is, of course, we eat because there's things about eating that are necessary. Number one, we need a source of fuel. It's true, you can fast, a healthy 70-kilogram male could fast probably 70 days or more, but eventually you deplete your reserves and you would starve and die. So we need a source of calories. Now, if all we needed was calories, the most efficient source of calories for humans is actually fat. We could maybe just drink oil. You could have a 55-gallon drum of oil delivered every few months and just, every day take a cupful of oil. But it wouldn't work because it turns out it's not just a couple thousand calories of fuel a day we need. There's other things we need as well. For example, we need water. We're mostly water, so we either need to drink water or eat foods that contain adequate water. We need protein. Protein contains amino acids. There are 20 amino acids that make up our body, but 12 of those can be made from carbohydrates, so they're not essential. But there are 8 amino acids as an adult, maybe 10 as a child, that are essential. That is, we must eat them in a preformed manner in order to get our protein needs met. We also need a source of essential fatty acids from fat, particularly to be able to form omega-3 fatty acids, primarily to form things like docosahexaoxalic acid and other essential fats. We also need vitamins to catalyze chemical reactions. For example, vitamin C. If you don't get enough vitamin C, you'll develop problems including scurvy, a serious connective tissue disorder. The people that used to get scurvy were sailors that would go out onto the ocean for 6 months and live on hardtack, dried meat and bread, and they would develop scurvy. Now, they learned that if they would take some limes along with them and suck on the limes, they didn't know what was in the lime. It was something that prevented scurvy. That something turned out to be vitamin C. That's why they used to call them limeys. Early research on vitamin C was very frustrating because they would use rats and mice, and it turns out rats and mice make their own vitamin C. Unlike humans, rats and mice can make vitamin C internally. Humans, the Indian fruit-eating bat, dachshunds, maybe a few other creatures don't make their own internal vitamin C, likely because we evolved in an environment that was so abundant in C that there was a biological advantage to not carry around that extra biosynthetic machinery. And so over time, we lost the ability to make vitamin C, but we get vitamin C abundantly in our traditional diets. And of course, there's a host of other chemicals in the form of vitamins that are important for getting these reactions. The most abundant source of vitamins for us today is, of course, fresh fruits and vegetables. Minerals also necessary, calcium, magnesium, zinc, iodine, etc. We also need to get fiber in our diet. Fiber is a really important component in our diet. It forms the bulk of the stool. It feeds the bacteria, the microbiome that live in the stool, particularly soluble fibers. If we don't get enough fiber, then our stools become very hard and we develop constipation, and then people strain their stools and they develop hemorrhoids and fissures and ptosis of the organs, including the uterus, and they get diverticulitis and they get varicose veins and all kinds of problems that come as a consequence of fiber deficiency. These conditions and consequences used to be very rare because people ate plant-based diets, but now, of course, they've become very common. And we also need phytochemicals. These are chemicals like resveratrol and there's 2,000 of these chemicals that come only from plants and are thought to help protect us and preserve our health. So whatever diet we put together, it better have enough calories and water and protein and fat and vitamins and minerals, fiber and phytochemicals. But it turns out you can get too much too. So the diet needs to not only ensure that we get enough, but it needs to ensure that we avoid too much. Too much calories leads to obesity, which leads to metabolic syndrome, which is the epidemic that we are suffering from today that's leading to premature death and disability in our society, from heart disease, from stroke, from cancer, from autoimmune disease, and even conditions like COVID-19 and other infectious diseases. People that have metabolic syndrome are dramatically more vulnerable to having serious consequences from all of these illnesses. Too much water, sure, too much water. If you force water intake excessively, you can get water intoxication. It can flush out your electrolytes, and in the worst case scenarios, even lead to death. Too much protein, major issues. Too much protein, even maybe more than too much fat, is responsible for everything from kidney disease, coronary artery disease, and problems with cancer and other issues. Too much fat, well recognized, excess fat intake. The fat we eat is the fat we wear. And so excess fat intake can lead, again, to obesity and all the downstream consequences. Too much vitamins, absolutely. In fact, it's really interesting. If you look at studies where they, for example, with cancer, where they tried to give vitamin A, thinking that that antioxidant effect would help people live longer with cancer, turned out to do just the opposite. And study after study, they had to discontinue the study because the patients that were supplemented with the vitamin pill were dying at a higher rate than the people that were not. So too much nutrients can definitely be a problem. In fact, it's a major problem in patients that I see. Sometimes just getting them off their big bag of pills and potions is enough to allow the body to start its necessary healing process. Now, there are nutrients that may be justified to supplement, for example, vitamin B12 in vegans, because vegans don't get the fecal contamination and other issues and other sources of B12 that meat eaters do. They do need to supplement B12 in order to ensure that they don't develop long-term problems. But in general, the best place to get your vitamins and minerals is from your whole plant food diet. Minerals, again, you got to get enough, but you don't want too much. Supplementing even common things like calcium can lead to kidney stones and other problems, and doesn't prevent the osteoporosis and issues that people think they're helping when they take these vitamin supplements. However, eating a mineral-rich diet, which essentially means a vegetable-rich diet, necessary to sustaining long-term health. Fiber, not getting enough fiber, as we talked about, can lead to serious problems with constipation and other problems. But getting enough fiber and the right kind of fiber, the soluble fiber necessary to maintain and feed the microbiome that lives in your intestinal tract. You have 5 pounds of bacteria living in your gut right now, an important part of protecting you, of forming nutrients that you need, protecting you from infectious disease and others. And so eating a plant-rich diet will allow you to have the diversity of organisms necessary to sustain optimum health. For example, people that eat a high animal food diet tend to produce massively more TMA, which becomes trimethylamine oxidase and is an irritating substance that's thought to be in part responsible for the increased risk of colon cancer and other problems associated with significant amounts of animal food intake. And phytochemicals, again, the only place you're going to get these protective nutrients is from plants, and you're not going to get too much unless you're relying on pills and potions. So the point is, we want to get enough, but not too much. The things we want to avoid in the diet include animal foods, though that includes meat, fish, fowl, eggs, and dairy products. Animal foods have a number of problems. They're no fiber and entirely fat and protein. And since minimizing fat and protein intake are desirable, you can see why it would be necessary to minimize animal food intake. And then there's also a major problem with all animal foods, and that's the concept of biological concentration. Animals concentrate the materials that they get exposed to in their environment, including pesticides and other chemical agents. And those toxins build up in the animal cells day after week after month, until eventually, when you kill that animal and eat it, or its byproducts, its milk or eggs, you get its entire lifetime accumulation of those toxins. And that's why if you did a fat biopsy in a human and you found there was PCB and dioxin and pesticide residues and all kinds of other toxins in that sample, which you would, but you trace back, how did that toxin get in the body of the human? It turns out as much as 90% of the total load of the typical person got there because of their consumption of animal foods, biologically concentrated toxins from the animal foods building up in the human that consumes those products. So just not eating animal foods puts you lower on the food chain and will reduce a significant source of the toxins that we're concerned about. And then the other things we want to avoid are the highly processed foods, which are actually chemicals added to food. And those chemicals include salt, oil, and sugar. Salt, oil, and sugar are not food. They are the byproducts of processing that are added back to food. And you'll notice on this list, we're going to put dairy products. Dairy is a very special food because it gets not only all the problems of animal foods, including biological concentration, excess fat, and protein, but it's also a highly processed food. So overeating on it becomes almost inevitable. And then, of course, we talk about things that help with obesity besides the animal foods, the salt, oil, and sugar. Some people understand sugar because they think, okay, refined carbohydrates stimulates insulin production, which drives your sugar down, which tells your brain you're starving. So it leads to the binging and the craving. Oil is pretty obvious, 9 calories per gram. Obviously no fiber, so no satiety feedback from fiber. And so easy to explain how that would help make people fat. But what about salt? Salt has no calories. It's an essential nutrient without which you would die. And it turns out, just like you can get all the carbohydrate and all the essential fats you need from your whole plant food diet, you can get all the salt you need from your whole plant food diet too, particularly a diet that's rich in vegetable materials. And the problem with salt, besides the fact that in a concentration, it's a toxin, and the body has to work hard to prevent you from being damaged by excess salt intake, it's also a stimulator of what's called passive overeating. So, for example, if you take a human or another animal and have it eat to satiety, it'll eat a certain amount, say, of rice or beans or whatever, and then it feels full. But if you take that same person, everything else being equal, give them the same food, but salt it, you'll find they'll eat more before they reach satiety. It'll be a powerful appetite stimulant. And some people think, well, yeah, it tastes better. What do you think tasting better means? It means that the substance is stimulating dopamine in our brain. Dopamine is the neurochemical associated with pleasure. And the more dopamine, the better it tastes. And so you're getting a drug-like effect when you're putting salt, oil, and sugar on food that tells your brain that that's a good thing. And as a consequence, we eat more. And that's why people are fat, sick, and miserable, because they're putting these chemicals on their food and they're consistently over-consuming. So when we put the diet together, we want to avoid animal foods and we want to avoid these processed chemicals in foods. So that means we end up with a whole plant food diet that's SOS free. SOS is the international symbol of danger. It stands for salt, oil, and sugar as well. So animal products have a number of problems. One is just their bacterial concentration, and bacteria have to be killed with cooking. If you don't cook the meat enough, you can die. So that's why we have health departments and all kinds of rules to try to make sure that the bacteria that are teeming on these animal products have been completely destroyed before you eat them so that they don't destroy you. There's also viruses like bovine leukemia virus associated with, for example, milk products. And they used to say, oh, don't worry about that. That just causes cows to get mad cow disease, or in the case of prions, I should say. In the case of viruses, the bovine leukemia virus, they would tell you, don't worry about it. You're not a cow. You won't get cancer. And that's exactly what they told us about prions, which causes mad cow disease. And in humans, we call it Creutzfeldt-Jakob disease, which is like Alzheimer's and fast forward. And it turns out that no, when cows are fed things like offal or sheep brains and they get mad cow disease and you kill the cow and eat it, you too can get exposed to those prions, which can sit in your body for months or years till they eventually manifest. And that's why, there was the big scandals where people didn't want to buy U.S. meat because we would test, one in every 2,000 cows and they would find it occasionally. So they said, well, maybe we should only test one in 10,000 cows. Maybe that'll help. That didn't help either because they still kept finding. So eventually they agreed to stop feeding offal to cows and make some changes so that we could reduce the likelihood of mad cow disease and Creutzfeldt-Jakob disease in humans. Animals are also concentrated sources of heavy metals, growth stimulants and hormones, and antibiotics. Most antibiotics actually that we produce are fed to animals. And then of course they can grow antibiotic resistant organisms over time. And when you eat the meat, you get exposed to those resistant organisms, and then they can cause you problems as well. Again, pesticides, often animals are exposed to massive pesticides, both directly and also indirectly through their food supply. Animals also are a source, as I mentioned, of biological concentration, where all the materials from their feed, from their environment, and that are injected in them directly accumulate inside their cells, biologically concentrate, and then they pass it on to you if you choose to participate in their consumption. So interestingly enough, today, if you look at people in industrialized countries, 93% of the calories that they consume come from either animal foods or these highly processed chemicals in refined foods. So meat, fish, fowl, eggs, dairy products, oil, salt, and sugar. Only 7% of calories come from fruits and vegetables. And of that, a third of it's one vegetable called potatoes, served almost exclusively as French fries or potato chips. Fruits and vegetables today have essentially become the decoration on the plate. So if we're going to avoid meat, fish, fowl, eggs, and dairy products, oil, salt, and sugar, what's left? Well, what's left are whole natural foods. So fruits, raw and cooked vegetables, raw nuts and seeds, and then complex carbohydrates. So potatoes, yams, squash, rice, millet, quinoa, beans, lentils, peas. We recommend avoiding the gluten-rich grains like wheat, rye, and barley, just because so many people seem to be sensitive to gluten. 1% of the population actually develops celiac disease, where their body's immune system will attack their intestinal tract. Another percentage may not get celiac disease, but their immune system may attack their thyroid instead. It's interesting that the HLA-DQ gene associated with Hashimoto's thyroiditis, the most common cause of hypothyroidism, is also the same gene associated with gluten sensitivity. And so the theory is that people that eat gluten, some people's immune system will attack their intestines, and we call it celiac disease. Some will attack their thyroid, we call it Hashimoto's thyroiditis. Some people seem to have problems with sinusitis or joint pain or other problems. So these gluten-rich products we try to avoid because it'll minimize overexposure to these proteins that can seem to be a problem for so many people. And it turns out if all of your calories come from fruits, vegetables, grains, legumes, nuts, and seeds, with the exception of vitamin B12, you get the vitamins, minerals, fiber, protein, and carbohydrate you need to sustain optimum health, and you avoid the dietary excess that causes people to become fat, sick, and miserable. This diet, when you break it down, comes out to be around 10% of calories from protein, about 15 to 18% of calories from fat, and the balance coming from complex carbohydrates. So we recommend that people limit their feeding window to somewhere between 8 and 12 hours a day, depending on what your goals are. If your goals are to lose weight or maintain weight, 8-hour-a-day feeding window seems to be helpful. If you're trying to gain weight or you're a high caloric demand individual, young growing person, then we recommend a 12-hour feeding window. And that means no food at least 3 to 4 hours before you go to sleep at night. And it might mean delaying breakfast so that you can do some exercise in the morning. It turns out that exercise during intermittent fasting may preferentially help mobilize fat stores. And so we divide that usually into 3 meal programs. Why do we eat 3 meals a day rather than 1 meal a day or 1 meal a week or 1 meal a month? The reason is because your feeding bag or the stomach can only handle so much food, so much volume. And these foods are very high in nutrient density, but very low in caloric density. And so as a consequence, you need to fill up that feeding bag 2 or 3 times a day just to get enough calories in order to meet your long-term needs. Now, you can certainly do less when you're in the weight loss mode, because you as long as you get enough to maintain basal function, you'll be okay. Until eventually you've depleted your reserves, and then of course you may need to go to a more aggressive feeding program. And we generally recommend 1 fruit and 2 vegetable-based meals a day. So a person might have, say, some oatmeal and fruit in the morning, maybe a few flax seeds. They might have a large vegetable salad, big platter of steamed vegetables, and some kind of carbohydrate. It could be potatoes, rice, beans, whatever. And we do that. And again, you could reverse the orders of these meals. There's obviously a lot of flexibility. As long as all of the calories come from whole plant foods and they're salt, oil, and sugar free, you're going to get the quantity and quality that you need and avoid the dietary excess that's so common today. So fruits, salads, steamed and starchy vegetables. If you're looking for cookbooks that have recipes that are vegan, SOS free, so exclusively whole plant foods that are free of salt, oil, and sugar, the Health Promoted Cookbook, Bravo and Bravo Express from the TrueNorth Health Center, are all the recipes are well tested, exclusively whole plant foods that are SOS free. And if you're interested in learning more about the pleasure trap, the hidden force that undermines health and happiness, you can certainly take a look at our book, The Pleasure Trap. So right today, obesity is beginning to rival tobacco as a cause of disability and death. Tobacco is still number 1, a fabulous way of dying prematurely, in large part because it affects almost every organ system in the body. But obesity is coming up rapidly as people become bigger, and this becomes a more dominant cause of death. In fact, this generation today may be the first generation that does not live as long as their elders. And in fact, life expectancy has gone down considerably here, even in the last few years. But we keep getting bigger as a society. In fact, when I went into practice in 1986, there wasn't anybody, any state in the United States that had over 14% obesity saturation. But you can see today, everybody's exceeding that. And here in the South, a home of deep fried ice cream, we've got 35% population self-reported as obesity. Now, it's important to understand that these numbers underestimate the actual obesity, because these are self-reported numbers. And it turns out people consistently underestimate their weight, not overestimate their weight. And so the actual percentage of obesity is even higher than it appears here. Nonetheless, it's clearly an epidemic. It's interesting, if you compare the correlation coefficients between, for example, obesity and diabetes, it's almost 1-to-1. The fatter we get, the sicker we get. It's almost like there's a connection. And the incidence of, for example, diabetes has been going up geometrically, including affecting our young children. But the dominant epidemic right now that we're suffering is metabolic syndrome. So that's where people's waist circumferences are elevated, their blood lipids are too high, or their blood sugar or blood pressure are elevated. If you have 3 or more of the factors on this list, you are, in fact, suffering from metabolic syndrome. And if you have metabolic syndrome, your risk of getting diabetes, your risk of coronary artery disease, your risk of cancer, or dying from COVID-19 or other infectious disease is dramatically higher. There's no question that metabolic syndrome is associated with these conditions. Everything from non-alcoholic fatty liver disease to coronary artery disease, myocardial infarction, congestive heart failure, diabetes, gout, colorectal cancer, liver cancer, and cirrhosis, and many others, including stroke. So what we're doing about it as a society is telling people to eat health food. And, there's major billion-dollar industry selling people, olive oil and red wine and dark chocolate and coconut anything, diet sodas, white meat, low-fat dairy, and they're just trying to encourage people to eat, the keto, paleo, high-protein, high-fat diets. And they'll recommend these high-fat, high-protein diets because they have a fasting mimicking effect. They will mimic the hunger blunting effect of fasting because you're in ketosis. There's no carbohydrate going in. And it's true that that will blunt your hunger and it might be responsible for short-term weight loss, but these are not long-term health promoting diets. This is not a way to eat if your goal is to live a long and healthy life. If you just want short-term weight loss, you can have somebody cut your leg off at the hip and take 40 pounds off overnight. That doesn't make it healthy. What I suggest we do instead of selling health food is focus on healthy food. And you'll notice there's no correlation between health food and healthy food. Healthy foods are fruits and vegetables, grains, legumes, nuts, and seeds, a whole plant food, salt, oil, and sugar-free diet. Health food versus healthy food. So the reality is 2/3 of people are now overweight or obese. That means if you're not fat, you are abnormal. And there's a particular type of fat that's particularly harmful, and that is visceral fat. That's the fat that tends to accumulate around your belly, around the organs. It's associated with inflammatory markers, including TNF alpha and others, that are tied to heart disease and type 2 diabetes and stroke and breast cancer and colorectal cancer and Alzheimer's disease. So getting rid of fat in general, but in particular, getting rid of visceral fat turns out to be critical if your goal is to live a long and healthy life and avoid spending years debilitated. We recently did a study where we used a DEXA scanner with some research software that does very detailed body composition. So we're able to determine what happens to people when they lose weight. And what we know that when a person loses weight, there's fat, including visceral fat, there's protein, fiber, water, and glycogen that are mobilized. And so here's an example of an individual that at baseline, compared to 15 days after medically supervised water-only fasting, and then after refeeding. And what you'll notice here is that weight goes down, obviously, when you're fasting, and that weight is composed of lean tissue, shown here in magenta, and fat. And then when people refeed, the lean tissue recovers, but the fat loss continues to go down. And so what we did in this study that'll be coming out later this year, we were able to take 30 subjects before, after fasting on follow-up, and then we did 6-week after refeeding follow-up. And what we found was that they would lose weight and regain weight, but the weight they lost was fiber, water, glycogen, protein, and fat. But the weight that they regained was lean tissue. And so by the time we were done fasting, they had actually recovered not only the lean tissue they had lost during fasting, but more. In other words, the amount of lean tissue on the body was higher at 6 weeks post-fasting than it was before they started fasting. But the fat loss not only went down during fasting, it continued through refeeding on a whole plant food diet. So this individual that went through 14 days of fasting lost a total of 12% of total body weight, 18% of their total body fat, but they lost 54% of their visceral fat. Over half of all their visceral fat was eliminated in just 2 weeks of fasting, 4% of lean tissue, and that lean tissue recovered during refeeding. And what this data shows is that the most efficient way of mobilizing visceral fat is actually water-only fasting. When people do water-only fasting in a resting state, they can preferentially eliminate their visceral fat, which is important in terms of metabolic syndrome and what we believe these risk factors are. For people interested in learning more about fasting, they can go to the TrueNorth Health Foundation's website at www.fasting.org. And all of our research and articles by us and others are located there, freely available, so you can learn more about this idea of how to mobilize visceral fat. And for people that are interested in general, they can go to our website at TrueNorthHealth.com, and all of the articles and other information are readily available there. Now, what's interesting, I just want to share this with you. if you feed, for example, rodents their normal rat chow in unlimited amounts, ad libitum feeding, they'll get to a certain size. And then satiety mechanisms kick in. But if you take those same animals and add the chemicals to their feed, the salt, oil, and sugar, they'll gain 49% of their body weight in 60 days because of the stimulation of dopamine in their brain that comes from eating these foods. And it's not just rats and mice and birds that get fat, it's humans as well. So right now, we spend most of our money in the United States treating the leading causes of death. That's heart disease, cancer, and stroke. But what we don't do is spend money on the actual causes of death. That is the reason people get heart disease, cancer, and stroke. And that's smoking cigarettes, drinking alcohol, and eating animal foods and highly processed refined carbohydrates. If we were focusing instead on the actual causes of death, I suggest that we could dramatically improve not the health, but reduce the costs of care in the United States. What's killing us clearly is these diseases of dietary excess and poor habits. Tobacco, as I said before, is number one. High blood pressure is not far behind it. Alcohol consumption, certainly not health food. They try to tell you drinking alcohol is some type of health promoting factor. They'll tell you it thins the blood, which is true. It does thin the blood, much like aspirin. So if you're on a greasy, fatty, slimy, dead, decaying flesh diet and at risk for a clotting stroke and you drink alcohol, you might be able to slightly reduce your risk of dying from a clotting stroke. But you won't reduce your risk of dying because you'll have an increased risk of dying from a hemorrhagic stroke. So, if you prefer to die from a hemorrhagic stroke rather than a clotting stroke, well, then maybe alcohol should be considered. But other than that, let it go. Cholesterol is a marker for how much animal food you eat. The more animal food you eat, the higher your risk of dying. Being overweight, not healthy, not eating fruits and vegetables, not getting exercise, illicit drugs, and unsafe sex. That's why people die. Those are the things you should put primary focus in eliminating if you want to live a long and healthy life. I just wanted to mention briefly this idea of intermittent fasting. Intermittent fasting is, as we mentioned, limiting your feeding window to 8 to 12 hours. That's something everybody can do, and it's a safe and simple process. There's no reason why people can't limit their feeding window. There's no absolute need to be eating all day and all night long. And if you're able to do that, you can make a substantial impact on your health. Longer term fasting should be done with the guidance of and the benefit of a history, physical exam, and proper supervision. Okay, and so with that, what I'd like to do is open up this opportunity for questions if we can make that arranged.
And we can certainly do that. Thank you very, very much. And thank you for the very thorough presentation as well. We really, really appreciate that. Once again, just for everybody, as we're bringing everybody on, the very best place, we know TrueNorth is the place. Where's the best place to get your books?
Well, you can get our books from Amazon.com, or you can go to our website at TrueNorthHealth.com, and we have a store there as well.
Excellent. Perfect. Thank you very much for that. So with that, and I don't know if you can leave your slide up, or if you want to close it, people might be able to see a bigger view of you.
So we want to click not stop sharing, but.
Yeah, I think you can even just close the whole. You can even probably do stop share.
Okay, how's that?
Yep, that's perfect. Thank you. So I also want to make sure everybody knows how we go about it here. And obviously, I know some folks do, because we see some raised hands. For those that are just joining us for the first time, we typically don't take questions directly from the chat box. We ask people to raise their virtual hand. And in case you don't know how to do that, you can look at all the different tabs that you have in your Zoom window. One of those tabs is called your Reactions tab. When you click on your Reactions tab, a few different emojis pop up, and one of them says Raise Hand. Click on your Raise Hand button, and we will go ahead and see your raised hand. I'll call you out by your first name, and I'll unmute you as I do. And with that, we'll get right to it. So thanks again, Dr. Goldhamer. And we have Wendy first. So Wendy, welcome.
Hi there. I'm in Boca Raton and I have been to True North. I'm a Hippocrates health educator. Okay, so Dr. Goldhamer, thank you so much. My question is I've gone to a few of the recent biohacking conferences, and they're really into high fat, the keto diet, and everything out there now is keto. As far as they say that you can only achieve satiety if you do this high fat keto diet. And I do have a problem. I am highly plant based with satiety. Then later I'm craving something, after I eat all my super healthy food. So, can you address the keto high fat and then also satiety without
Sure.
the high fat? Thank you.
Yeah. So it is true that eating in the originally they talked about high protein, high fat diets. That's pretty much been acknowledged as being a health compromising habit. So then they tried to improve it by going on a plant-based, high fat, low protein diet. The idea is to mimic fasting's effect of hunger blunting. One of the problems that people have is because they're used to eating refined carbohydrates, is that their blood insulin levels are not stable. So they eat sugar, the blood insulin goes up, it drives the sugar down, the brain thinks you're starving, you get cravings and binging, and this goes on and on. And it's very difficult to reach satiety. When people do fasting, of course, they stabilize their blood sugar, blood insulin levels, which is why 80% of our type 2 diabetics will achieve normal blood sugar without medication. And it happens in people that are not diabetic as well. They get much more stable. That can also happen over time with a whole plant food diet, particularly if you're willing to do really radical things like exercise and get enough sleep, manage your stress and other issues. And so it's true that the short-term effect of a high-fat diet may lead to better satiety control, but the longer-term effect of a whole plant food SOS-free diet yields the same kind of satiety control, but without compromising your health long-term. So our goal is not only to live a long life, but to avoid the debility that most people suffer from. Eating high-fat, high-protein diets doesn't allow that to happen. In fact, it leads to other problems. People end up with all kinds of gallbladder problems and digestive issues, and ultimately increased risk for heart disease as well. So I'm thinking long-term, not short-term. Long-term whole plant food SOS-free diet, 10% of calories from protein, 15 to 18% of calories from fat, and the balance from complex carbohydrates, not refined carbohydrates, along with moderate exercise, appropriate rest, people are able to achieve and maintain normal weight control with this. If you're a male, you can expect about 3 pounds a week of weight loss. If you're a female, just 2. Women are going to lose on average about 50% less than a male, everything else being equal, because they have lots of estrogen, which is a fat storage hormone, whereas men tend to have higher testosterone levels, which is a fat burning hormone. So if you're a male, it's going to be a little bit easier. Doesn't mean you can't be fat, but you're going to have to work harder at it than your female counterpart. It's going to be, in fact, women say they don't even have to, if they just walk by the buffet table, they gain a pound, or have a bad dream and they go up a dress size. And it does feel like that because women are biologically designed as energy conserving fat storage devices, females of all species, because they have to survive a period of vulnerability called pregnancy. So their ability to be able to store fat was a biological advantage. And in a natural setting, it would be, because you'd get enough to eat and live to reproduce. Your ancestors, if you're a female, were the ones that got enough to eat and didn't get eaten. And they were the ones that could efficiently store fat because they evolved in an environment of scarcity, not this environment of abundance that we live in today. Today, if you have those, what would have been an advantage in a natural setting is a disadvantage today, because you have to work twice as hard for half the results in order to be able to achieve and maintain optimum weight. You just can't get away with anything. And that's why I tell people, if you really want to know, should you eat something or not, just look at the substance and close your eyes and go inside yourself and ask yourself honestly, do I really, 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 really want whatever it is? And if the answer is truly yes, you can't have it. You get nothing, because if you really, really, really want it, you want it that badly because it's activating the pleasure trap and you're dealing with some of the drug-like effects from the dietary choices you have. It doesn't mean you're not going to like your food. It doesn't mean you're not going to like to eat. But it's like the difference between loud rock and roll music and classical music. It doesn't mean you can't enjoy music, having classical music, but it's not going to have the same overwhelming impact on the nervous system short term. But you do adapt to it. You get to the point where ultimately you'd actually prefer it.
Now I have to stop eating my Van Halen. Thanks. Thank you very much for that, Dr. Goldhamer. And let's go now to Andrew. Welcome.
Thank you, Dr. Goldhamer. Love your work. As far as Crohn's disease goes with water fasting, I think you've written some or had some experience with some remission. How long of a water fast have you seen remission with Crohn's disease, and how long has that remission lasted? And a follow-up to that is, can water fasting address fistulas, the symptoms non-surgically from Crohn's disease? Thank you.
So yeah, we treat lots of patients with Crohn's and colitis and other conditions involving chronic inflammation in the digestive system. Again, these are autoimmune diseases where it's the body's immune system that's attacking itself. And what we believe contributes, besides the genetic predisposition, and higher tendency for some people to be vulnerable to this, is the alteration of the gut microbiome. We know that there should be 1,000 strain or more of different organisms living in the intestinal tract. And these are living creatures, 5 pounds of living creatures that are living and eating and drinking and defecating inside you. And what your organisms poo inside your intestinal tract, could be TMA and other toxic agents, or it could be fertilizer like vitamin K and nutrients you need. And what determines what your organisms poo in you, it depends on what you feed them. So if you feed them a diverse plant-based diet, you're going to have a completely different microbiome than the people that are eating meat, fish, fowl, eggs, and dairy products. In fact, we've done the first study on long-term water fasting's effect on the microbiome. We did it with Luigi Fontana from Washington University. Those results will be coming out later this year. So, and what we believe we're going to be able to demonstrate is that diversity post-fasting with a whole plant food diet is a way of kind of rebooting the microbiome. It's like rebooting the hard drive in a computer that becomes corrupted. You don't know why, but the thing's not working, it's freezing up. You shut it down, you turn it back on, and for whatever reason, now it starts to work again. Well, we believe that there's an analogy to fasting and doing a similar kind of functional correction. And hopefully we'll be able to prove that shortly. As far as Crohn's disease, ulcerative colitis, all the various manifestations of inflammatory bowel diseases, fasting can be an effective way of shutting down everything. And then you reboot with a carefully controlled diet to meet that individual's needs so that the inflammatory process can heal and the gut leakage can heal. When you have intestinal mucosa with a fine membrane with tiny little holes that don't let things like bacteria or protein molecules through. But if that intestinal mucosa becomes inflamed from exposure, for example, to free radicals, then things can leak through. Free radicals could be coming from smoking, peroxidation of alcohol, drinking alcohol, eating high-fat, high-protein foods, particularly cooked at high temperatures. These rich sources of free radicals can lead to inflammation. Inflammation leads to gut leakage. Gut leakage stimulates the immune system to react to those proteins. And in vulnerable people, the immune system will attack its own tissues. If it attacks the intestinal tract, we call it Crohn's or ulcerative colitis or one of those conditions. If it attacks the kidneys, you might be calling it lupus, or the skin is vasculitis, or the lungs might be asthma. We see psoriasis. We see all kinds of conditions. In fact, we have a paper coming out on plaque psoriasis that's really quite dramatic, where again, the immune system is attacking the skin and it responds dramatically to fasting and this dietary approach. Now, you asked about how long will the results sustain. Much like the treatment of obesity, you can't cure obesity. You can lose the weight and keep it off, but you have to keep eating well. With Crohn's, you can't cure Crohn's, but you can get its symptoms under control and keep them under control. But you have to be willing to continue to eat properly. You have to continue to get enough sleep and dissipate stress with exercise. So you have to live healthfully in order to sustain these results, because this is not a cure, it's a management strategy.
Thank you very much for that, Doctor. And let's go now to James. Welcome, James.
Thank you very much, Doctor. You're a national treasure. I've 7 years remission from lymphoma, and I've gone whole food plant-based 3.5 years ago, and also gluten-free. Any other suggestions? I know you guys have had some great results at your TrueNorth.
We're very excited about the effect of fasting on lymphoma. Our first published case paper was 6 years ago. We had a 42-year-old woman with stage 3 follicular lymphoma that came in, and despite less than enthusiastic support from her oncologist, she underwent 21 days of water fasting, during which time her tumors disappeared. And we followed her for 3 years with follow-up CTs, et cetera, and we're able to show that her lymphoma resolved. And now we have a 6-year follow-up with whole body CT showing that she's maintained cancer-free. And we've published those in the British Medical Journal's case reports, which is really was really good. It's a big impact journal. And then since then, and since the publication of those cases, we've been treating a significant number of patients with lymphoma, including stage 4 lymphoma with infiltration into the marrow. We've just recently had some very exciting results. One gentleman actually, you could see or feel improvement, went back to his oncologist at 3 months, who wouldn't actually do the CT that we wanted at that point, because he said the person had obviously improved so dramatically, there was no justification. Wanted to wait till 6 months. So we're waiting for the 6-month follow-up. Now we're optimistic that we'll see great results there. We have another one also that we did fasting with that has had excellent results. Both of these were 40-day water fasts. So the person came in and fasted on water only for 40 days, during which time these conditions came under control. And what's exciting is we're now showing 3 or 6 year and longer follow-ups. So not only can people bring the condition under control, but they're able to sustain the control. But again, this is with a whole plant food, SOS-free diet, sleep, and exercise. So what we're hoping to do is publish this cohort later in the year, and then we want to do a clinical trial where we'll get, for example, 60 subjects with lymphoma, divided randomly by assignment. Half will undergo fasting and dietary care, half will get conventional care, and we'll compare long-term to see which group does dramatically better. And so we are excited because so far the results that we've seen have been very gratifying. And for those willing to do really dangerous and radical things like eat well, it looks like they're able to sustain those results as well.
Radical indeed. Thank you very much, Doctor. And
well, you know, radical means, if you go back to the original word, it means from root or cause. And so we are radical because we're trying to deal with the root or cause, which are the diet and lifestyle factors that make people sick.
Got it. Thank you for that. And so now we'll bring in David R. Welcome, David.
Hello, doctor. I'm a vegan, try to minimize my SOS. And I did omega score testing lately and find that I have a severe deficiency in omega. I got a score of 1, which recommended is to be above 5. Although I eat daily 4 tablespoons ground flaxseed and lots of walnuts and lots of other nuts and seeds that have omega. So my question for you is, how would you recommend to handle such a situation? Would you recommend to do, although you are not recommending oil, to take plant-based oil like flaxseed oil and some other that press gold, or how would you recommend to deal with omega-3 deficiency, although a person or a patient take flat seeds and nuts on a daily basis, but still have such a low score?
So I wouldn't recommend the use of oils at all. You can certainly make sure the consumption of whole foods, you know, your ground flax seeds or hemp seeds, your walnuts are appropriate and sufficient. In the worst case scenario, for some reason, your absorption capacity or conversion capacity to make docosahexaenoic acid or other essential fatty acids is limited, you can use vegan supplementation of those substances. They do have, I think Murtec has a process where they use algae and are able to, form DHA, so that your body wouldn't be limited in terms of converting omega-3 across. So I would say consult a plant-based nutrition person. If you're interested in a doctor that's familiar with this, you can go to our website, healthpromoting.com. We have a telemedicine practice with a dozen clinicians that can help you fine tune, your particular individual situation. So there's an affordable way of getting access to a doctor that's not an idiot, that's, experienced with people actually getting well. And all you have to do is you go to our website, healthpromoting.com, you complete the registration forms, which gets us your medical history. We offer a no-cost phone conversation to match you with the best doctor for your situation. And then you can consult with the doctor of your choice through Zoom or through the phone. So it's a nice service. It's available to people all over the world. So that works out well.
Thanks, Dr. Goldhamer. And let's go now to another David A.
Hi, how you doing?
Good.
I was just curious, except for obesity, what are the most common health problems you address with fasting? And I was wondering if that includes hypothyroidism. And secondly, I was curious to know, when you do a water fast, ideally, should you gradually precede the actual fast by eating maybe one meal a day, or doing a juice fast just prior to the actual water fast? Thank you.
Right. So those are very good questions. The second one I'll answer first. It's very important that appropriate pre-feeding be done before fasting. The best pre-feeding is not to go to one meal a day or to do juices, but to eat a whole plant food, SOS-free diet, particularly rich in salad, steamed vegetables, and fruit. We ask people to eat exclusively raw fruit and cooked vegetables for 2 days prior to fasting at least. So that means, salad, steamed vegetables, potatoes, sweet potatoes, squash, and fruit, but no concentrated foods, no processed foods, and certainly no animal foods or coffee, alcohol, or the rest of it. And that makes the transition to fasting much more pleasant. You don't want to go through caffeine withdrawal at the same time you're trying to adapt to the fast. It's just unpleasant. And so proper pre-feeding, very, very important. It also allows the bowels to be evacuated before we get too far into the fast, and not leave residual materials behind that can be a problem. And then, I'm sorry, what was the first part of the question?
The first part of the question, can you hear me?
Yes.
Okay, the first part of the question was, I was just curious to know, what are the common health problems besides obesity that you address with fasting, and would that include hypothyroidism?
Yeah.
And I guess the other part would be, how do you determine the number of days you should fast? Is that just based on individual medical history? Thank you.
Yeah, the number of days is going to range anywhere from 5 to 40. That just depends on the person's history and how they respond to fasting. Fasting is diagnostic as well as therapeutic. So sometimes just how you respond to the fast gives us insight. For example, if you have high blood pressure, we want to fast until the blood pressure is normal. So, depending on if your blood pressure is 220 over 120 over versus 150 over 100, may determine how long it takes to normalize that effect. So, fasting duration. Now, as far as conditions, it's not surprising to hear that the conditions that respond the most efficiently, the most effectively to fasting are conditions that are caused or aggravated by dietary excess. So obviously obesity is an issue, but also coronary vascular disease, particularly high blood pressure, type 2 diabetes, autoimmune diseases, the whole host of autoimmune diseases, and also lymphoma is something we've been treating a lot of. So these are the conditions that we treat the most. They represent probably 80% of our patient base. Some conditions that have nothing to do with dietary excess are less likely to respond to fasting. But what we do is we review a person's medical history in detail before, and we do this for no cost. So we get their medical history when they complete the registration forms. We offer a no-cost phone conversation with me, and we go through your medical history and see, is fasting appropriate? How long a fast is probably going to be your target? What can you do before fasting to get ready for fasting? What can your expectations be? Are you going to respond? How well? And once we've reviewed your medical history, your lab, we can usually give you a pretty good idea, just based on our experience of having done this 21,000 times over the last 40 years. Are you a candidate? What's likely to happen? And we can also try to match you with a facility closest to you. In other words, not everybody can get to TrueNorth Health Center in California, but there are other doctors we've trained around the country that are offering fasting supervision in a controlled setting. And for people that can't get to a facility, we offer remote fasting supervision, as long as you have a doctor that's cooperative at your end in terms of providing history exam and monitoring. We have doctors that'll work with your doctor and work with you so that you can do this safely and effectively if you're an appropriate candidate for that.
Thanks very much for that, Doctor. And let's go now to Rebecca. Welcome, Rebecca.
Hi, thank you. Dr. Goldhamer, do you have experience with the impact of fasting and plant-based eating on Lyme disease?
I do. I just wanted to finish that one thing I forgot to mention in the earlier gentleman's question was about hypothyroidism. And hypothyroidism, as I mentioned, is often associated with the HLA-DQ gene. And you're not going to change the genetic predisposition. And if a person's been on thyroid replacement for many years, you may not be able to completely get them off thyroid replacement therapy either. But if it's new onset hypothyroidism or unmedicated, oftentimes we can see normalization. Typical standard in fasting is reduce thyroid replacement therapy by half and then remonitor, remeasure, and determine what the appropriate level of replacement therapy, if any, is needed after fasting. So some people do respond, but there are many people, particularly that have been on thyroid replacement for years, are going to continue to need some level of replacement therapy. And it's one of the few drugs that we can actually continue during fasting safely. As far as Lyme disease, we are in an area that's endemic to Lyme in Northern California. So we've seen lots of patients with acute Lyme disease and chronic Lyme disease. And they're managed very differently. With acute Lyme disease, much like syphilis, this is a spirochetal disease and is responsive to antibiotic therapy. If you do 10 or 20 days of doxycycline, you can often nip it in the bud, so to speak, early on, and then treat the person for the consequences of the antibiotics after that to reestablish normal gut flora. However, what we treat the most of is chronic Lyme disease. And this is Lyme disease that was not detected early and treated effectively, or they've been on IV antibiotics for years, and now they've got a wiped out microbiome as a consequence of their treatment. The Lyme itself may be gone, but the consequences remain, and it manifests very much like autoimmune disease. In fact, many people that think they have chronic Lyme actually may have had Lyme at some point, but now they have autoimmune disease. And then they take more antibiotics and they feel better because the antibiotics have an immunosuppressive effect, so it shuts down the immune system a bit, but it's not actually resolving a problem because the problem is no longer the Lyme, but either associated infections with other organisms, or it's just an autoimmune response itself. And those patients often respond dramatically well. Like all autoimmune patients often respond well to fasting. So we do the fasting, get them on the diet, hope that's sufficient at resolving the issue. If it's an acute onset Lyme, then we might use more conventional treatment initially until the acute infection is resolved, so as we don't need to deal with these chronic issues down term. I'd also like to say a related condition, interestingly enough, is long COVID. So we're getting large numbers of people now that got COVID, recovered from COVID, but still have residual symptoms of brain fog, fatigue, neurological symptoms, chronic pain, just terrible, much like you see in chronic Lyme disease. And interestingly enough, we have the first report that'll be coming out. This was on a nurse that had a 2-year history of long COVID that underwent 40 days water fast resolution of the condition. And what's unique in this case, not just clinically resolving all the symptoms, but we had research markers done, detailed blood values done that were extremely out of line before, consistent with chronic Lyme or chronic long COVID. And now we have post-fasting and follow-up lab, and we're able to show the changes that occur. And so we'll be looking to publish that case hopefully shortly. I think May 1st we get our follow-up data. Hopefully it'll be as consistently good as it was short-term. And in which case that'll open up a new option for people to consider with long COVID or chronic Lyme disease.
Thanks very much for that, Doctor. And up next, we're going to bring in Stephen V. Welcome, Stephen.
Thank you. I've followed you on the internet for years, Doctor, and I'm very impressed with you and Dr. Doug Lyle and Chef AJ. And I'm from Buffalo, so I don't know if I'll ever make it out there, but recently, I was interested in the fasting, but I did the Prolon. I did the Prolon 3 times. I've done 3 cycles with my friend Hillary. And it's not easy, but it's not horrible either. And I know you've talked a little bit in the past about Dr. Walter Longo and maybe doing a study with him or comparing the two. Now, my friend Hillary just in the past year developed migraines, and I know that you've had some intriguing results with migraines. So maybe talk a little bit about fasting mimicking diet and migraines.
Well, yeah, I'm glad you mentioned Dr. Walter Longo, who's really has done some heroic work at USC. They've got dozens of clinical trials going now, and he's been principally interested in investigating intermittent fasting. So the use of his product, which is basically 700 calories used for 5 days consecutively, as a way of kind of breaking the dietary habits that people are doing and inducing some of these fasting mimicking effects. And of course, he and I are both interested in that, as well as the effect of actual fasting, long-term fasting. And the problem with long-term fasting is it does need to be medically supervised. You need a history exam and monitoring in order to ensure that it's safe. In fact, Walter Longo in his book on fasting says, don't do long-term fasting because it's too dangerous. But there's one caveat. He said, unless you do it at the TrueNorth Health Center, in which case it's okay. And so I evaluate other researchers' intelligence based on how much they agree with me. And so Walter Longo is a genius, as far as I'm concerned. And as far as long-term fasting compared to intermittent fasting, that hasn't really been done yet. So we're looking forward to comparing. And what one of their suggestions is maybe as a means of improving compliance after fasting, maybe there's a role for intermittent fasting. And so that's something we can look at as well. The big challenge is not just getting people well, it's getting them to stay well. We're starting to do these 1-year follow-up data. And so now we're excited to see that a significant number of people can adhere and comply to these diets. That was challenged early on. They said even if they can do it when they're at the TrueNorth Health Center, they won't be able to do it when they go home. We're able to now start to demonstrate that no, in fact, it is possible. We do acknowledge that it's very difficult. It's hard for people to live in a world designed to make them fat, sick, and miserable and stay healthy because they're not getting the support that they need. And that's why I think it's good that people like Dr. Longo are coming up with plans that can be done safely by people without necessarily having to go to an inpatient facility or have direct medical supervision. It'll certainly open up the intermittent versions of fasting to a large number of people.
Thanks for that, Doctor. And let's now go to Deborah M. Hi, Deborah.
Hi, can you hear me?
We can, thank you.
Okay, yeah, I had a question, it really is around when you break your fast, just with doing like the intermittent fasting, or even if you're not fasting. The question, what I've gleaned from this whole conference a lot is about glucose, glucose levels, and how that seems to be really integral in affecting so many other things and spiking and trying to keep things consistent. So what I'm battling with recently, after all these days with you all, is what is the thing I'm supposed to eat in the morning that is not going to elevate my glucose, that's going to set me off on a day of all bad things.
So the problem isn't that food elevates glucose, it's that the glucose levels and the insulin levels are sustained in an aberrant manner. And that's because people have insulin resistance. And the diet that makes you fat is the diet that causes insulin resistance and allows you to build visceral fat. So you have to be careful. What's good, what they're trying to do with these short-term high-fat diets may not be the diet that you need to eat long-term that's going to actually sustain health. And the diet that you eat long-term will not only allow you to lose weight, but it will also allow you to stabilize your blood sugar and insulin levels. And so what we're recommending people eat, you might have in the morning, for example, fruit and greens, or you might have oatmeal and greens. We always like people to include plenty of raw vegetable materials because the high fiber content tends to slow down the rate with which sugar is absorbed into the system. And as does fat. So if you have, say, some oatmeal with some ground flax seeds, some grains, and perhaps some berries, some fruits like berries tend to have a lower glycemic response than other fruits. Trying to stick to whole fruit rather than juices and dried fruits and more concentrated sugars. That works well even for people with some level of sugar sensitivity. We want large amounts of salad and steamed vegetables during the day with enough complex carbohydrates in the form of rice and beans and starchy vegetables that you don't get too skinny. We're looking for an ounce of nuts or seeds a day, avoiding meat, fish, fowl, eggs, dairy products, oil, salt, and sugar. That ends up with a diet that's around 10% of calories from protein, about 15 to 18% of calories from fat, with the balance coming from complex carbohydrates that tend to absorb at a much more stable rate than the refined carbohydrates that make up 86% of the carbohydrates that most people eat in the diet. Most carbohydrates are flour products and sugar products. We all agree you need to eliminate that. But what we don't agree is that necessarily the healthiest long-term diet would be very high in fat and eliminating the main primary fuel that humans are designed to burn, which is complex carbohydrates. And that's where there's a difference between the approach that we take, other people take. But what I would say is that all of us, it's incumbent upon all of us that are making these claims to prove it. So look at the outcome data, and that's where I'm really excited to show that not necessarily our way is the only way, but that we are able to show that people are able to not only get well, which we're able to see at the TrueNorth Health Center, where we're living with our patients, we have them in a controlled setting, but that they are able to sustain that when they're free living, and that the results, the objective biomarkers, the clinical outcomes are demonstrated. And so a lot of people make a lot of claims, but I don't see them putting the effort into actually documenting whether what they're doing actually works in long term as well as short term.
Thanks very much for that, Dr. Goldhamer. And up next, we have Sandy. Welcome, Sandy.
Hi, doctor. My question is around tips to gain weight. I'm basically healthy.
Yes.
And does fasting, because it might reset absorption or something, help with that? And also, are you referring to Himalayan and Celtic sea salts when you say get rid of all salts?
Yeah, the only advantage to the quote Himalayan or Celtic sea salts is that they're contaminated with other minerals, so the concentration of the sodium is somewhat less per volume. But it's like saying honey versus sugar. Yeah, honey's twice as sweet per gram of sugar, so you'll eat less of it. But eating less of it doesn't solve the problem that you shouldn't be eating any of it. You get the sodium you need from your diet, your whole plant foods, just like you get the carbohydrate you need. You don't need to add sugar to your diet. You don't need to add oil to your diet. You can get the fats, the carbohydrates, and the sodium from the actual whole foods.
Okay. And tips to gain weight for?
Yes. So we don't recommend an 8-hour feeding window in people where they're underweight. Well, first of all, you want to make sure, are you underweight? That's number one. Or are you under lean tissue or under fat? So, most people are not, if trying to gain weight is about putting muscle mass on and additional lean tissue, the way you have to do that is you have to eat more calories than you're burning. So that would mean we'd increase to maybe a 12-hour feeding window instead of an 8-hour feeding window, just to allow more opportunity to get food in. And we do just the opposite of what we do for most people. Whereas most people, we say, eat brown rice, don't eat rice pasta. Eat whole oranges, don't drink orange juice. That is, we may process the food a little bit more if we're trying to gain weight, just to remove some of the fiber, allow people to override their natural limiting satiety response so they can get a little bit more caloric density in. But more importantly, is begin stimulating anabolic growth with exercise. So weight training in particular, or resistance training, doing exercises that cause resistance so you can build muscle mass, because you're trying to put muscle on, not just store fat. And so increased caloric density, increased resistance training, increased sleep and stress management. Too much stress and the hormonal effects that it have can alter absorption and digestion and peristalsis. Think about when animals get stressed, they tend to get increased parasympathetic tone and diarrhea and other problems. So we want to do the things that are going to allow the body to absorb its food better. If you can eat and chew your food thoroughly, that stimulates digestive secretions and allows for better absorption. If the food you eat is clean food. And if you have a disrupted microbiome, sometimes, believe it or not, fasting can be useful. A short fast, just for the purposes of correcting the gut microbiome, may allow you on the same diet to then be able to start absorbing food and gaining weight. For example, our fasting patients have a higher lean mass 6 weeks after fasting than they did before they started fasting, even though they've lost weight and their fat loss has been substantial.
Thanks very much. And up next, we have Lois. I'm going to ask you to unmute, see if that'll help us. Hi, Lois.
Hi, good morning. Dr. Goldhamer, do you believe that whole food plant-based older individuals need more protein? And if so, what percentage would you recommend?
Yes, we recommend that people get somewhere around 10% of their calories from protein. And that's, ironically enough, about the percentage of calories from protein that come in a whole plant food diet. And particularly if you're willing to include a small quantity of things like nuts or seeds in the diet, we recommend an ounce a day. Things like walnuts or flax seeds, if you're able to eat those without them being food triggers or being problems, it really isn't very difficult getting enough protein in the diet. Also, there are some plant-based foods that are particularly rich in protein, like, for example, beans, lentils, peas. These are, a significant percentage of your calories coming from protein. And all plants have protein. Even watermelon has some protein in it. So when all of your calories come from whole foods, getting enough protein really isn't an issue. It's a bigger concern avoiding excess protein. It's excess protein that's really more of a major health risk, and particularly excess animal protein, because the high sulfur amino acids associated with animal protein also associated with conditions like osteoporosis and kidney disease and cancer. So we really don't want to be eating those foods. And you don't have to make up for the lack of those foods. You just have to get a whole plant food SOS-free diet.
Thank you very much for that as well, Dr. Goldhamer. Up next, we're going to bring in Steve. Hi, Steve.
Hi, Dr. Goldhamer. Steve,
Hello.
how you doing?
Doing great.
Steve in his sweatpants, because you told me put some clothes on the other day. Have a young friend of mine. She's not 40 yet. Severe liver disease, on a transplant team, and too sick to go forward with the transplant. How do we deal with this sort of thing? And another friend that's on dialysis. Like, how do we deal with these really sick folks?
Well, you can't fast the patient on dialysis because they're not going to be able to hold up to fasting. So when the kidney disease has gotten to so badly that you're not able to fast, we have to limit it to dietary intervention. And even that has to be carefully manipulated because of even potassium clearance and other things. That's definitely something that would require advice from one of the medical doctors at the TrueNorth Health Center, and they can access those people through telemedicine. That's not something that my general advice is going to be sufficient for. Number of things you have to consider on how you're going to try to feed. And honestly, when the kidneys are damaged to the point that you're on dialysis, you're just hoping for stability. It's unlikely to be able to get enough improvement in the kidney function that you'll be able to get off dialysis. Many people we get before they go on dialysis are able to slow down progression, and sometimes considerably. And there is some reversal with creatinine levels dropping, but you have to get them early enough where there's still some kidney function left, because the kidneys process the blood and remove the toxins from the body. When the kidney function is so limited, it's very difficult to do efficient detoxification. And as far as what was your other diagnosis?
Liver failure.
Oh yeah, liver failure. Yeah, depending on how bad the dysfunction is, if they're bad enough they're not even willing to do their transplant, that's probably fairly substantial dysfunction. Again, the focus is going to be fine-tuning dietary issues. The body's pretty forgiving when it comes to liver function. We've seen pretty dramatic improvements with dietary change, but I don't know that you'd be able to jump into fasting. You may be able to do some intermittent fasting. There may be some more limited steps that can be done. Those aren't the patients that you'll see generally populating the TrueNorth Health Center. Usually our patients are the ones that still have enough function that they can have a dramatic short-term result and make us look good.
Thanks very much, Dr. Goldhamer. And up next, we're going to bring in Ainsley. Hello, Ainsley.
Hi, everyone. Morning. Ainsley from TrueNorth Doctor. Although I'm doing my fast right now, am I allowed to drink saffron water? I'm talking about the saffron threads.
Well, we don't use any substances except pure water, and generally that's pure distilled water during water-only fasting. Anything you introduce in fasting can alter the fasting process. Even 10 mils of carbohydrate, the lemon in lemon juice that people add, can alter how the body adapts to the fasting process. So we want to be careful that when water fasting is appropriate, when it's properly supervised and it's done effectively, it's done exclusively on water only. Now, some cases you have to modify that. Not everybody is able to adapt to that effectively, but we wouldn't be using any exogenous agents in our experience with water only fasting. And now,
So
we have
therefore,
21,000 cases where we've done it this way. We don't have experience doing it a different way. So that would be an experiment that would have to be done to see if it enhances or deteriorates from the process.
so therefore, I should stop all my antioxidants as soon as I start my fast. When I say
Oh, you
antioxidants,
definitely don't want to be supplementing during fasting.
So don't.
Strongly
Just
contraindicated.
Oh.
Even medications, for example, that you might normally get away with can be very much problematic during fasting. There can be a great potentiation of pharmaceuticals. For example, you can burn holes in people's stomachs and create all kinds of problems. You do not, in our experience, there's no supplementation used during fasting, and no medications used during fasting, with a couple rare exceptions. I mentioned already, thyroid replacement therapy, if it's monitored properly, can be continued during fasting. It may need to be continued during fasting at a reduced dosage.
And finally, doctor, for me, when I do my fast, on my day, I break my fast and I wash my hair. I realize I have a little bit more hair shedding.
Well, you don't want to wash your hair on the day you break a fast because you're vulnerable to orthostatic hypotension. You may find yourself passing out, and that's a problem. Any hair shedding isn't going to be when you break the fast. It's going to be about 30 days post-fasting, or anytime there's rapid weight loss or pregnancy. And what happens is those pregnancy, rapid weight loss of any kind, including fasting, causes the hair follicles to mature. And so instead of falling out over time, they'll come out together. There shouldn't be any loss in hair overall, but it may cause a short-term shedding effect. And so people often report that about a month after a rapid weight loss of any kind, and then the hair comes back and it's fine. There is the possibility, if you have an unrelated condition, a thyroid-related condition or something, that may be affecting hair loss. There's other dermatological issues that can affect hair function. So that should be checked out by your doctor. But as far as hair loss, it's a little bit too early right after a fast to be expecting that there would have been anything related to the fast. The fact you haven't been washing your hair, though, may mean it'll look like there's more hair coming out just because you're flushing it out all at the same time.
How soon can you go ahead and take a shower after fasting?
Well, it depends on how long the fast is. It takes half the length of the fast usually to recover from fasting. And most people, by the time they're on whole food, they're going to be able to begin to restore normal activity. So, for example, let's say a patient fasts for 3 weeks. They would have 2 to 3 days of juice, a day of fasting for every 7 to 10 days of fasting would be a day of juice, a day of raw food for every 7 to 10 days of fasting. So it might take them 4 or 5 or 6 days to get to where they're now eating some steamed and starchy vegetables. And then when their blood sugars are stable, they may then be able to go back to more normal activities, start exercising again, doing other things. But you don't want to recover so quickly that you end up with problems, because a lot of the toxins that have been mobilized during fasting are actually eliminated during the initial days as you come off the fast. If you look at the urine in patients as they start coming off the fast, it's much more concentrated than it would have been during the fast, because a lot of that stuff is now getting a chance to process and be eliminated. So fasting is important, and that half the length of the fast recovery is important. Those need to be done properly. That's also why we like fasting people in a controlled setting much more than at home, because people make so many mistakes, they just muck it up, and then fasting gets a bad reputation and people get hurt. Too rapid recovery in feeding can lead to refeeding syndrome. It can alter your electrolyte balance. It can lead to cardiac arrest and death. So now generally that's more common on long fasts, not necessarily a short fast. But I get calls every week from people that are in trouble because they've done a really poor job of either not resting during fasting, gotten dehydrated, they re-alimate inappropriately, and so then they get into trouble there, or they go to the emergency room because they're having symptoms and they don't recognize the effect of fasting, so they'll hyperhydrate them and put them into congestive heart failure or create some other mess. So if you're going to fast, do it every day for 16 hours safely. If you're going to do a longer fast, get the benefit of a history exam and lab from your local doctor working with one of the TrueNorth doctors, or come to the TrueNorth Health Center or one of the other clinics that we're affiliated with and do it properly. It'll be a life-enhancing epiphany experience. Patient satisfaction is very high with fasting. It's really remarkable. We had a person here who did her PhD on fasting behavior in humans, and they contacted 600 people that had fasted, many of which had been 10 years or more since they went through fasting. And they asked them, you know, what was your experience? What happened? Would you do it again? Were you satisfied? Would you refer others? Patient satisfaction was actually higher than what they had registered for outpatient massage. You know, very high patient satisfaction. And it's weird because, you know, persons say, oh, what happened? Oh, I had low back pain, headache, nausea, vomiting, skin rashes. Would you do it again? Oh, yes, highly beneficial. Would you recommend others? Oh, absolutely. And so the person that was in charge of the studies, their supervisor said, oh, this is Stockholm syndrome. These people were so traumatized by fasting that they identified with their captors and thought it was a good experience because they experienced Stockholm syndrome, you know, like Patty Hearst with that whole thing. And so, and the students said, well, wait a second, these people had not been there for 10 years. And Stockholm syndrome degrades over time. They said, oh, well, maybe it was more severe than Stockholm syndrome. And it had some kind of permanent damage to their body and their mind. And of course, that's not at all what happened. It's just people got perceived benefit. Now, what's interesting, you think this was 25 years ago. You think, well, today, you know, people wouldn't say that. We just had a journal article rejected by a major journal. And the editor said that although the article was well constructed and well written, it represented fasting people for 2 weeks to look at their body composition changes. He said it was the most egregious violation of human safety standards that he'd ever heard of in 25 years of editing a journal. Now, remember, this is a journal that's had studies like cutting the nerves through the kidneys as a way of treating high blood pressure. I mean, some really barbaric stuff. But fasting for 2 weeks and monitoring body composition constituted the worst violation of human safety standards he had ever witnessed. Now, our director of research was thinking, oh my goodness, they think we're doing bad things. Of course, what I'm thinking is, oh, wait, no, you don't understand. Listen carefully what he said. We're the worst violation he's ever witnessed. That means we're number one. It's always good to be number one. I might mention that same article has since been accepted and is going to be published. It'll be coming out later this next month in another journal.
Thank you for clarifying all of that. Really, I think that's really helpful for everybody. Amazing stuff. Let's go on now to Benny. Welcome, Benny.
Thank you so much, Doctor. I've read about fasting that talks about colon cleansing and gallbladder flushing during the fast. Do you do that or recommend, or can you comment?
We absolutely do not recommend gallbladder flushing. People will give people olive oil and lemon juice, and then their gallbladder throws up soap balls or olive oil balls, and they tell them it's gallstones, which is, you know, usually nonsense. But you don't need to make your gallbladder vomit bile, because the body will flush itself naturally during fasting, and you will see yellow and green bile showing up. It can be very unpleasant. If you have existing stones, you may pass those stones. That can be rather entertaining as well. But you don't need to go in there and irritate and stimulate the system. That's one of the things that people don't get, is that anytime you stimulate the system, there's going to be some compensatory depression. That's also why we try to avoid colonics and other bowel stimulants during fasting, because we don't want to overstimulate the system. The system will take care of itself if you get out of the way. So it's very rare that we have to resort to any of these types of therapeutic interventions.
Thanks very much, Doctor. And let's go now to Lorraine. Hi, Lorraine.
Hello, good afternoon. I have a ongoing problem of sleep problems. I've been taking supplements for 30 years. I do not have sleep apnea. I do everything you tell me to do. I walk a mile a day, and I'm trying my best to get off these medications. So I don't take them for about 4 days. I sleep maybe 4 hours, maybe 6, but not good sleep. And then on the 5th day, I take a sleeping pill, sleep great all night long. I'm sure that must be one of the reasons I'm losing weight so slowly. And I do practice intermittent fasting.
Yeah, you covered a lot of things in this question. In order for people to sleep well, they should have good sleep hygiene. And there's a number of books that talk about this in detail, Power Sleep and others. And the idea is you sleep in a cool, dark, and quiet place. You don't let things disturb you. You turn off the phones. You don't have the pets in the rooms. You make sure, like you did mention, that you don't have sleep apnea, or if you do, you correct it with CPAP or whatever you need to do. That you have, you deal with appropriate mattress and support. Sometimes, if people have back pain, they want to sleep with a cushion underneath their legs or between their legs. There's issues you can do to improve your sleep hygiene. Some people have trouble getting to sleep. Some people have trouble staying asleep. Those can be different causes. Some people having trouble falling asleep can even relate to stress-related issues. And there's all kinds of techniques you can use to get the stress out of your head and make it more possible to initiate sleep. Some people have trouble staying asleep because they wake to pee, or they have prostate problems, or they have other issues that are disrupting their sleep cycle, and improving those other things can be tremendously helpful. That's one of the reasons why with fasting, you see a lot of people that have chronic sleep problems corrected, not just because of the effect of fasting on the neurochemistry in the brain, but because now they're not waking up 5 times a night to pee because their benign prostatic hypertrophy reduced, or they're not waking up with pain because their chronic inflammation is resolved, or their headaches are resolved, or their other issues. So it does have to be approached comprehensively. You look at both the physical as well as the psychological variables and try to address all of them. And then, if necessary, reboot the whole system with fasting. And in most cases, we're able to get improvements. Now, the problem is, there's an interesting book out there that's called Anatomy of an Epidemic. And Anatomy of an Epidemic talks specifically about serotonin uptake inhibitor medication. But the principles that are outlined in that are going to be very much the same with the medications that are used, some of which are quite dangerous. Ambien and others can be quite problematic. And the withdrawal of those drugs is difficult because when you've deactivated the D2 receptors in the brain, for example, with serotonin uptake inhibitors, you get anxiety and depression when you withdraw from those drugs. And that leads people into thinking that they have a brain deficiency and they need those drugs in order to function. But if you can just get far enough away from the addiction or the dependence on these medications, eventually the brain may be able to reestablish a more normal cycle, particularly with good hygiene and the rest of it. And that's why if you're having trouble doing it on your own, come to the TrueNorth Health Center, undergo a reboot, work with a doctor that's experienced in people getting well, and spend enough time to actually get the system working right. Because the long-term use of these sleep medications is going to make the problem probably worse, not better. They become part of the problem. And I know it can be really difficult to solve these problems, but once you do, you won't mind all the effort you had to put into making it happen, because it not just solves your sleep cycle, but it improves your overall health and reduces your likelihood of debility.
Thanks, Dr. Goldhamer. Up next, we're going to bring in Sylvia, and welcome, Sylvia.
Yes, thank you. Good morning.
Good morning.
I was wondering, would I qualify to go to TrueNorth? I have rheumatoid arthritis. I weigh about 103 pounds. I am whole food, plant-based, oil-free. I try to be salt-free. I use a little bit of salt, but
how tall are you?
I'm 5'1", and I've been dealing with rheumatoid arthritis for 11 years. I went plant-based, vegan about 3 years ago. And lately, since June, I've had such a flare up, so much so that my fingers are starting to get deformed. And I feel like I've become sensitive to so many foods, and I'm not sure what to do.
Are you medicated right now?
I am. I'm taking 5 milligrams of prednisone, sulfasalazine, hydrochloroquine. And recently I started taking Arava because I just can't seem to control the inflammation.
Okay. So, obviously it would be better if you smoked and drank and were 50 pounds overweight and had 50 things that we could tell you to easily change. You're in a situation where it gets much more difficult because the fine tuning is much more precise. There may need to be more of a nutritional medicine approach taken initially to get you stabilized. You're going to have to wean off medication, which can be very difficult with steroid drugs, in order to be able to fast. At some point, even though you're thin, a short fast may be really helpful in terms of dealing with the consequences of your current treatment model. So what I would suggest you do is go to TrueNorthHealth.com, complete the registration forms. We'll talk. There's no cost to talk to me. We'll talk about matching you with a doctor. We'll get you to do a Zoom consultation with one of our doctors who will work with you and your local doctor to figure out a strategy to wean off the meds and stabilize you enough that we can try to do some fasting. And then after fasting, hopefully you'll get enough improvement that the need for medication can be eliminated. Because the meds themselves can be a challenge, as you well know, over the long run. The fact you're already doing a plant-based diet, that would be the first step. The fact that that's not enough means we need to tighten up the screws there even further, and then probably look at some type of fasting regime to try to bring your inflammatory processes under better control.
Okay, thank you, doctor. I will make sure that I go.
I'll look forward to talking to you, sure.
Thank you.
Thanks very much for that, Dr. Goldhamer. Let's go now to Bailey. Welcome, Bailey.
Oh, thank you so much, Dr. Goldhamer. Thank you for the presentation. Earlier this week in this wonderful conference, they had a panel that included one of your TrueNorth staff doctors, Dr. Hellman, who did a fabulous job as an outlier on a panel with Brian Clement, Gabriel Cousins, and some guy named Udo. And basically this panel said we should never eat fruit, we should never eat starchy vegetables or grains, and we should have a lot of oil. And I didn't know who this Udo person was, so I Googled him, and basically he sells oil. And I'm wondering if you think this is confusing advice and what you think about the recommendations to never eat fruit, grains, starchy vegetables, and to consume oil.
Yeah, well, I completely disagree with consuming oil, and I think that whole plant food diet is the basis for getting healthy. What people do short-term therapeutically to try to bring acute conditions under control in patients that aren't perhaps willing to go to these radical extremes in terms of eating healthy and sleeping, that's not my area of experience. So I have difficulty commenting on how effective that kind of approach is. But all I can tell you is what we do. And we use a whole plant food SOS-free diet, and we've been able to demonstrate in the conditions that we treat that this can be done safely and effectively. As far as eating oil and not eating carbohydrates and trying to do kind of a vegan high-fat diet, again, I'd like to see long-term data that suggests that builds long-term health. As far as what you do short-term to bring acute conditions under control, that those interventions vary all over the place. But that's not consistent with what the recommendations we make at the TrueNorth Health Center. And some of this is taken from work that's been done showing that, for example, cancer cells, unlike human cells, natural human cells, which are adapted to fasting. In other words, fasting is a biological adaptation in humans. People had to be able to fast to survive. All the people that can't fast died. That's why we call it an adaptation. Virtually every human being. What fasting really is your brain, which is your biggest burner of glucose, changes from burning sugar to burning fat, particularly beta-hydroxybutyric acid. So when the body does that, the human cells are adapted to that, and they can survive in a ketone-rich diet. Cancer cells don't do so well in a ketone-rich diet because they have a higher metabolic rate than human cells. They are exclusively designed to burn sugar. And so when you remove the sugar, the cancer cells are at a selective disadvantage. And that's where, if they do intermittent fasting or long-term fasting in conjunction with chemotherapy, you can get dramatically better results, because the cancer cells, through differential stress resistance and differential stress activation, don't do as well adapting to that state. So it protects the healthy cells from the damages of chemotherapy. It makes the cancer cells more vulnerable to the chemotherapy. And the moment Valter Longo demonstrated that, pharmaceutical companies changed fasting from being criminal quackery to cutting edge research, because they said, oh, we can use our drugs more effectively in the fasting state than the feeding state. And now what they're trying to do is come up with what are called fasting mimicking drugs. So drugs that would do to your body what fasting does, but without having to do the fasting, and in a form that they could sell. So there's lots of research going on with intermittent fasting and fasting. But again, what you might be interested in is, what's evidence do we have for long-term health promotion and stability? And in my opinion, the best evidence supports a whole plant food SOS-free diet, exercise, and sleep at sustaining long-term health. And even in people with cancer, our approach is to not do necessarily just fasting mimicking approaches, but to actually do long-term fasting, which we believe has a potentiating effect in giving the body a chance, and then sustaining it with a whole plant food SOS-free diet. Now, it's a good thing that we don't all agree, though, because if everybody agreed with us, there'd be no reason for me to be here, would there?
That's certainly a question to ponder. Thank you for that, Dr. Goldhamer. Let's go now to Yaron. Yaron, are you there?
Hello, doctor.
Hi.
Hi. So a follow up to the question about the omega. You said that you mentioned omega-3 from algae, and I read some researches that say that they have oxidation even more than fish oil. So I wonder if you know about this. And about distilled water, you mentioned also distilled water. There are some people that say that, it's not healthy to drink distilled water because there are lack of minerals. What you're thinking about this?
So first of all, with minerals, let's be clear, you get your minerals in massive concentration from your plant-based foods. The amount of minerals you're going to absorb from water is relatively limited. It's not, you're going to get more minerals from your apple than you're going to get from the water you're going to drink. It's not a primary source of mineral absorption. It can be a source of heavy metal absorption, which can be a problem, leads or zinc. It can be a source of contamination in terms of cryptosporidium and other organisms and whatnot, chlorine, contaminants, hydrogen, halocarbons, et cetera. So you certainly want purified water. It doesn't have to be distilled. You could use reverse osmosis. There's lots of ways to purify water. But when you think about natural water, rainwater in a clean environment would be distilled water. I mean, it's not something that you're looking to the water to be your primary source of mineral consumption. So by using highly purified water, yes, you eliminate those trace amounts of minerals, but that's not a limiting factor on a whole plant food SOS-free diet. It's eliminating much more risk from contaminants than some theoretical beneficial effect. And the idea that water is hungry and it's going to suck all the minerals out of your body through the intestinal mucosa, that's not really supported. In fact, you have a gradient there that your body takes things in, it doesn't push stuff out the other way because the water happens to be demineralized. And a lot of these are marketing campaigns from people that are selling alternatives to distillation. They'll try to downplay distillation. But the fact is, the purest water on the planet is distilled water. That's the water that we use. It's best accepted by fasting patients. We've done this for 21,000 patients over 40 years and have good track record of success. I also do know other facilities, though, that use other means of purification, and that's fine. I don't have a problem. It's not a mandatory thing that you use a particular type of filtration, but you want one that's effective. Just a carbon block or something is not going to be sufficient to get enough of the contaminants out so that fasting patients will accept water during the fast. You also don't need to spend thousands and thousands of dollars to alkalinize water or change the water spin or whatever. You can use any type of effective filtration and minimize most of the potential damage from water contamination.
Thanks very much for that. And
I think he had a second part. It was water. What was the second part of that?
We lost him, but Yaron, if you want to come on back, and we'll see if we can get to squeeze that question in. We do have a couple more follow-ups as well. One coming in from Ainsley again. Hi, Ainsley.
Hi, doctor, and hi, Ben again. Can we use our regular cosmetics like on our face or on our body, or does that alter anything during our fast? And also, you just said it about distilled water. I am now looking to buy a hydrogen machine from Japan that's supposed to make the water more wetter, as they say. What's your views on that?
I think you should save your money and put it into doing things that will be productive for you rather than making water wetter. I think whatever filtration you want to use, if you want to go to Home Depot and get some reverse osmosis canisters or Costco, or you can go to Pure Water and get a countertop water distillation system. I don't think you're going to have to get too carried away to benefit from water. Again, what you're trying to do is just get some clean H2O. It doesn't have to be rocket science, in my opinion. And as far as cosmetics, you don't want to use cosmetics during fasting. You don't want to be putting even substances you might get away with in the feeding state can become irritative. And you want to be able to tell the difference between a skin rash from some toxin that they've got in your cosmetic versus a natural healing crisis that's going to come up and resolve. So, you see a lot of things that happen in fasting that can be quite dramatic, and you want to be able to tell the difference between a good thing and a bad thing. You can't do that if you're adding too many variables like cosmetics and whatnot. And the skin isn't a limited organ, so it's nice to let the skin shed and slough and get rid of this. Now, if you get too much dryness, sometimes we'll make an exception and use a mild emollient without any scent or anything, just to help people be reasonably comfortable. But even that can be a sign of dehydration or other things that gives us insight. So at TrueNorth Health Center, we monitor patients twice a day. So doctors are seeing our patients at least twice a day. And we're looking at all these variables. We're collecting this information. We're doing the blood and urine testing. And that's how we've been able to do it 21,000 times safely and effectively. And when you start introducing other variables, of course, you introduce significant complications. And a lot of times, if people are having symptoms we don't expect to see, the first question is, oh, what are they doing out of protocol? What are they exercising? Are they moving around too much? Are they not drinking their water? Are they using cosmetics? Have they been taking something in terms of supplements or medications? Because usually it's them doing something wrong that's responsible for the symptoms that we see.
That certainly makes sense. Thank you very much for that. And David A. has a follow-up. Let's get there. Hi, David.
Hi, how you doing?
Good.
Before you eat nuts, seeds, or grains, should you soak them overnight or over a certain period of time to help with digestion? In particular, with chia seeds, I understand if you just grind them and don't soak them, then you'll have to drink a lot more water because it absorbs water. So I was curious to know what you thought of that, and also using a dehydrator. Thank you.
Okay, so the soaking nuts and sprouting nuts and stuff may increase their water content and allow you to get better digestion, particularly, like you say, if people don't chew their food properly, then it's going to be much harder to digest. That's why we oftentimes will grind nuts or seeds just before use, just to increase the likelihood that people will actually break them down properly. Soaking them first may be fine if you want to do that. I think for most people, as long as they limit the quantity, they chew the food or grind the food properly before they consume it, they get pretty good absorption for most people. For people that don't, though, no problem doing sprouting or soaking. That shouldn't be a limiting factor. And as far as a dehydrator, anytime you concentrate the food, whether it's dehydrating it or juicing it or processing it, you increase caloric density. So if weight loss is a concern, we want to minimize these highly processed foods. If weight gain is a goal, then it might be useful to do a little bit more of this processing in the form of dehydrating or drying. And there's some practical suggestions. You're going hiking or backpacking, you want to have foods, and you don't have, you can't carry a refrigerator on your back to take all your fresh fruits and vegetables. That may be a time when using the dehydrator can be good. Or you're living in Minnesota and you want to, grow food limited, you're going to preserve it. Dehydration, freezing, these are all methods that can be useful to preserve food out of season. And so, but again, keep in mind, when you dehydrate it, you take the water out, you increase the proportional caloric density, which means you increase the likelihood of over consuming beyond your satiety mechanisms.
Thanks very much for that, Dr. Goldhamer. I'm going to bring in now Michelle. Hi, Michelle.
Hi, thank you, Dr. Goldhamer. It's my understanding, and I'm looking for you to confirm or deny if this is true or not, that outside of medically supervised environment, drinking distilled water for a prolonged period of time is actually not the best choice of hydration, because what I've been told is that it demineralizes the body because it is basically dead water.
So there's no real physiological truth, in my opinion, to that, because the minerals that are in your body aren't getting sucked out through the intestinal mucosa into the gut lumen and then flushed out in your urine or stools. And there's no evidence or data that I've ever seen that support that idea. It's an interesting theory pushed out by people originally that did solid carbon block filters as a competitive advertising campaign against distillation. And again, don't believe that that's physiologically valid, and certainly don't see any problem. Again, we've used distilled water as our primary drinking and cooking source for decades. And I think using any highly purified water is better than using municipal water. Distillation is probably the most effective and efficient, but it's certainly not the only way of getting the stuff out of water that you don't want there. The fact that if you think about it logically, though, and you figure how many milligrams of calcium or whatever are going to be present in your water versus look at your diet, There's no reason to be thinking that water that you're consuming is any primary source of essential nutrients.
Thanks very much for that. And Gary has a question. Let's go to Gary real quick. Hi, Gary.
Well, hello. Dr. Goldhamer, I was wondering if you wanted to do some limited type fasting at home, say a 3-day water fast or a week on fruits and veggies. What do you think about using an herbal laxative the night before and or Epsom salts added to your bath?
Yeah, I think it's a really bad idea. Again, you don't want to irritate and stimulate the bowel unless necessary. What would be better to do is fast every day for 16 hours. And then if you want to do a longer period of fasting, make sure you're a good candidate for that. So a history exam and lab, but then, and that when you fast for any time over 16 hours, that you're taking it easy and resting and being smart about it. And don't stimulate your bowels by taking an irritant. Instead, eat just fruit, salads, and steamed vegetables for a couple of days, and your bowels will work hopefully properly without having to be irritated. And then you won't have sluggish bowels post-fasting to lead to complications and problems. So I think that's a much better strategy. It works well for us, even in people that have long histories of difficult bowel problems. I think there's a few mistakes that people make when they fast at home. If they don't make these mistakes, it can be done safely and effectively. The one mistake is some people fast that shouldn't fast because their history exam and lab suggests they're not good candidates for fasting. They're on medications. They have had recent MI. They're on anticoagulant therapies because of myocardial infarction or pulmonary embolus, or they've got a history of recent stroke. They have problems with kidney function, or they have difficulties that contraindicate the benefit of fasting. They do the fast, but then they don't rest during fasting, so they dehydrate. They're too active. They don't realize the vulnerability they're in. And then they go to pass urine or have a bowel movement during fasting, they pass out, crack their head, and it gets to be a problem. Whereas that could have been avoided if they were just aware of, the fasting processes. And then the biggest mistake people make fasting at home, they might rest, have a good fast, but then they refeed too aggressively. And it's very difficult not to do that because your brain is saying, oh, good, it's time to eat again. This may be our last chance for a while, eat more. And so people overeat, and if they've done a long fast, they can actually get very seriously ill and refeeding syndrome, end up in the hospital and have a mess. Or if it's a shorter fast, they can make themselves ill or just undo some of the benefits they would have gotten from fasting because of their inappropriate refeeding. And so the people that are disciplined enough to eat properly to begin with are often the people that do well with home fasting because they have the discipline to do it well afterwards. People that are having trouble doing the right thing before they fast almost never do well with home fasting. They need to be in a more controlled setting. For good candidates, they still would want to work with one of our or other doctors that are familiar with fasting so that they have somebody they can talk to when the inevitable healing crises show up, and they can differentiate a good thing from a bad thing. And unfortunately, a lot of doctors are completely unfamiliar with the physiology of fasting. So they see the normal reactions that happen to people in fasting and think that it's a pathological problem. And the way they go about dealing with those problems can often be counterproductive. And so that's where it gets a little bit complicated. And, we are in the business of doing research around long-term medically supervised fasting. And so I just want to be clear, everybody can do short-term intermittent fasting on their own. That's not a problem. Everybody can eat a health-promoting diet. But if you're going to do a long-term fast, do it right or don't do it. Now, there's other programs like Walter Longer's program or juice fasting or modified dietary techniques. Those can be done often very safely. And your doctors and your naturopaths may be familiar with those, and they can guide you through that and make sure that be done. Even there, you want to be careful about any medications you're on. That's an important consideration. But those are much safer programs. They're not quite as dramatic. It takes a lot longer to get the same changes you see with water fasting. But the water fasting has that unfortunate reality that to do it safely, you need a little bit of support in making that happen effectively.
Perfect place to end it right there. And thanks for sharing all of that. We're sorry we didn't get to the last couple of questions there, folks. We're out of time. We're up against the clock for our next lecture, but we appreciate the few extra minutes you spent with us here, Dr. Goldhamer.
And if they didn't get the questions answered, just call TrueNorth Health. I'll be happy to answer their questions.
That's amazing. Really. Thank you for offering that up. So everybody, again, call TrueNorth Health, and you can get a hold of Dr. Goldhamer. And thank you so much for your presentation. Thank you for being here again at The Real Truth About Health. We're so glad that you keep coming back, and your information is too vital not to have you. So thank you. And I'm not the only person that wants to thank you. We're going to unmute our entire audience. Tech team, please go ahead and do that. What does everybody want to say to Dr. Goldhamer?